Hello, my name is Dr. J. Michael Bennett. I'm a member of the Fondren Orthopedic Group. I am a board-certified orthopedic surgeon who subspecialized in sports medicine and surgery of the shoulder, elbow, and knee, as well as some hand surgery. Today we're going to talk about a very common pathology that we see in a lot of patients, and it's called the trigger finger, or a locking finger. Most patients will present with a severe pain with flexion of the finger where they cannot bend their finger due to a pain or locking sensation at the base of the finger. It's very common in patients that work a lot with their hands, or it can be seen in patients that are diabetics. Sometimes it can be associated with some sort of trauma to the finger, to the tendon itself. But oftentimes they'll get a locking sensation in the finger followed by pain, and then they'll usually feel a pop. If you palpate the base of the finger, sometimes you'll feel a nodule there. And usually that just means the tendon is swollen. So each of these tendons are going through a number of tunnels in the finger that allow you to bend and extend the finger. They're called pulleys. And when the tendon gets inflamed, it has to squeeze through that pulley. This is a very crude picture here of a hand, and it's just showing you one of the pulleys here that's involved. This is actually the A1 pulley. It's called the A1 pulley. And so what happens is that you have an inflamed area of the tendon that creates a nodule, okay? And that nodule, the tendon gets swollen and has to slide in and out of that little pulley, okay? As that tendon gets crammed through that pulley, it gets locked and it gets stuck, and it can become painful. Sometimes we can treat this with anti-inflammatories and it can go away in very mild cases. Sometimes the doctor may even inject a little bit of steroid right along this tendon sheath here to see if that'll help decrease the size of the tendon, help with the inflammation, allow the tendon to glide a little bit easier. But if you continue to have locking or triggering, the third option is actually going in there and doing a release, where you do make a little incision in the region of the palm here and you release that pulley. You actually make a cut there. When you release the pulley, it opens up this sheath here. That sheath gets opened up and it allows the tendon to glide back and forth without getting caught up into that pulley. It's important that if you do decide to try an injection, that you do not get multiple back-to-back injections. You want to give yourself plenty of time before you get a second injection, because steroid injections aren't necessarily good multiple times back-to-back. You usually want to give yourself at least a few months before you get a repeat injection, because it can be associated with tendon ruptures. However, that should be discussed between you and your doctor. This is a very successful procedure in regards to taking care of the locking issue with the tendon. If you have any questions or comments, please feel free to go to our website at www.orthopedicsportsdoctor.com and or give us a call at our office at 281-633-8600. Thank you very much.